Hello friends, am I audible and visible? Very good evening. Please let me know in the chat box if I'm audible and visible to you guys so that we can start the class. Just let me check whether I'm audible or not. Just give me check. Okay, just give me thumbs up or something. Hello, Carson. Chalo, let's start the class. So this is specifically for first year prof, right? So we are going to go in a bit of the detail of CVS physiology. Yes, anybody on the Zoom? Right. In my side, the video is going perfectly fine. Okay. मोबाइल में चैट आई थी, इसमें नहीं आई. Okay. Audible, nature creation. All right. Chat दिख लीजिए. Hello, Maggie. Not total CVS. Total CVS is not possible, Ajay. I hope I could have been, but no. That is not possible in one class, definitely. All right. So let's start with the class. And yes, we are going to cover few part of the one of the part, or we can say some correlation also with it, right? And you are going to guess the topic of today's class. Okay. So what is heart, bacho? What do you mean by heart? Hello, Manzar. So this is the heart. It's a blood pumping machine and not something else, right? What is taught us by the Bollywood, we can say it's not that, right? So Bollywood says this, right? But we are the medicos. We are not going to blame it for something else or some other emotions, right? So that is the case. Muscular pump. Yes, it is the muscular pump which gets blamed for the failed relationship, isn't it? Or any other cause, right? So we are not going to do that, right? And the message with which I want to start the class is this one, that is think big, trust yourself, and make it happen. Okay, there is a slight lag that I'm getting because of some technical issue, but I hope we can manage, right? Right. So with this wonderful message, let's start the class. And via looking at this pic, can you tell me what is the today's topic or what can be today's topic? Hello, Dr. Path. Barcelona. Hi, guys. Hello, everyone. I'm in Maulana Azad Medical College. Yes. So can you guess the topic, today's topic? Please guess today's topic. No, Parth, it is impossible to cover whole CVS, isn't it? If you demand, we can do a rapid revision of CVS later on, but today we're not going to do that. Yes, it is cardiophysiology, but which topic? Can you see there are two parts? So we are going to learn about cardiac cycle. Okay, so we are going to learn about the cardiac cycle. So open up your mind. I want this class to be fully interactive. Yes. All right. Cardiac cycle. Wonderful, Priyanshi. Wonderful. Hello, Dipayesh. So let's start. What do you mean by cardiac cycle? Now, cardiac cycle, if I have to tell you. So first of all, whatever question comes, specifically it is of 2 marks, 4 marks, or 8 marks, you always will write the definition first, and then you'll move ahead. Right? So first thing first, you're going to write the definition, whatever it may be, just write the definition. And cardiac cycle can come as the long question also. Then you have to write everything. Okay, and its correlation also. I'm going to give you the questions that can come as a prof and the MCQs. So pay attention, and we are going to solve the question with the timer. Okay, so 30 seconds I'm going to give. If you have great concepts, you make the concept correct, definitely you will be solving those questions in 30 seconds. Right. So definition, what is cardiac cycle? It is the sequence of event. Sequence of, we can write electrical and mechanical events. Electrical and mechanical events in the heart or of the heart. It is mechanical events of the heart occurring in one beat. Right? So during one beat, whatever sequence are occurring, now pay attention. It should be both electrical as well as mechanical. Please understand there are two different things which are happening, and if you get confused, you're not going to get the graphs, and you will be having the problem specifically in the depolarization, systole, and RRP, ARP, all these things. Okay, so we are going to tackle one by one. Always remember E comes first, so that's why electrical events are going to happen first. That means the depolarization, repolarization, hyperpolarization. Mechanical events, on the other hand, we can see as in the objective world, and that is going to be contraction, relaxation, all these things. All right. So let's start with the cardiac cycle, how you're going to calculate it. Duration. If I have to say that, okay, so duration, first thing first, cardiac cycle. Duration, how you're going to calculate the duration, and what are the duration that we are going to see. So first of all, we are going to divide them into atria and ventricle, atria and ventricle. And there are two things which are going to occur, that is systole and diastole. Systole and diastole. So what are the duration? I hope everybody knows. Atria is smaller as compared to the ventricles, and that's why the work which will be done by the atria, it is going to be for the lesser time. So again, the diastole is going to be of a longer time, and systole is going to be for shorter time, right? That means heart rests more, right? So rest is important, isn't it? So atria, in the atria, the systole is going to be for 0.1 second, and in the ventricle, it is going to be for 0.3 second. About the diastole, it is going to be of 0.7 seconds, and over here, it is going to be for 0.3 second. Combinedly, it should be always and always 0.8 second. Now, how to calculate it? Remember that whenever I want to calculate the duration of cardiac cycle, what can be easily measured? That is going to be your heart rate, which you can even easily measure via the pulse also, right? So, and we know that we are calculating it for a minute, and that's why in a minute we do have 60 seconds. So that's why the formula is going to be 60 upon heart rate. 60 upon heart rate. Yes, Monica, Dipesh Sahu. Yes. Wonderful, guys. Wonderful. Okay. So this is going to be the formula, and let's move ahead. Yes, everybody knows this. Now, in cardiac cycle, as we discussed, there are two parts. One is systole, one is diastole. Now, there are sounds also. What your heart says, your heart is going to make some sound, and that is not for calling someone. It is just S1 and S2, isn't it? So if someone says that my heart is bigger, please advise him to go and do the echo, right? Why? Because he is having cardiomegaly. Right? Someone says you that you live in my heart. So please kindly stay away from such a creeps. Why? Because we are not streptococcus to live in someone's heart. Right? So first thing first, if someone proposed you like this, immediately block them. Right? So we are medicos. We are going to talk in terms of medical terminology. We can say that whenever I see you, I get tachycardia. That is still acceptable, isn't it? So first thing first, S1 and S2, there are two sounds which are audible, though there are 4 different types of sound that we are going to discuss. But remember, the audible capacity of human ear is 20 hertz to 20,000 hertz. And these S1 and S2, they are more than 20 hertz, and that's why they are audible. On the other hand, S3 and S4, they are non-audible. Why? Because we are not bat, right? Hum chamgadar nahi hai, right? So that's why below 20 hertz, we cannot hear anything, right? And that's why S3 and S4 are non-audible. Fine. From S1 to S2, that is going to be systole, and from S2 to S1, that is going to be diastole. Now, diastole means heart is relaxing, right? It is relaxing for more time. And whenever I'm saying systole, and I'm not saying atrial systole, unless and until I'm saying atrial systole, that means we are talking about ventricular systole and ventricular diastole itself. Right? And you can see over here that ventricular systole is 0.3 seconds and ventricular diastole is 0.5 seconds. But if I tell you the exact values, you'll be shocked that it is 0.27 seconds. And over here, it is going to be 0.53 seconds. That means almost double the time the diastole is there. That means double the time. In let's say in a day, 16 hours, the heart is relaxing and only 8 hours it's working, isn't it? So that is how we are also going to do. We are going to give a full power pack in 8 hours, and then we are going to chill out in 16 hours. Okay, fine. Right. So that is the scenario, and we are going to start off with the systole. Then we are going to discuss diastole also, and then we are going to discuss what are the correlationship, because this is going to be a long question. So you have to write everything. See, first of all, for how many marks the question are asked. If they're just giving you what are the phases, then just write phases if it is asked for 2 marks. But if it is for 8 marks, you have to write in detail and you have to make the diagram also. All right. So can you tell me from where to where the systole starts, Bacho? Can you tell me from where to where the systole is going to start? Blood भी कुछ time के लिए रहता है. Okay. Fine. So systole is going to start from S1 to S2. Now what we are going to do is that we are going to make 3 parts of systole and 3 parts of diastole. Though there are 5 phases, but for our ease to understand and to remember, we are going to divide it into 3 different phases. So what are these 3 different phases? Early, mid, and late. Early, mid, and late. Remember, that means we are having early systole, mid systole, and late systole. Now, why we are making these 3 different phases or 3 different parts in the systole? Because whenever you're going to hear the abnormal sounds, that is called as murmur. Yes, Varun. So these murmurs are divided into these 3 types depending on in which phase you are going to hear the murmur. So early murmur, early systolic murmur, mid systolic murmur, or late systolic murmur. So whenever you're going to hear these murmurs, you'll get to know in which phase you're going to have the problem in the patient's heart. Okay, and that's why we are going to divide it into three different types, right? So first of all, S1. Remember, what is the first alphabet in the English? It is A, isn't it? So that's why, remember, over here, the valve is going to close, and that is also going to start with the A, that is AV valve. And always remember, suppose this is the valve. Valve opening will never make a sound, but valve closure is going to make a sound. So remember, always and always, valve closure is going to make a sound, never the opening. Okay, if opening is making sound, that is something abnormal, right? So S1 is going to be the first alphabet, that is AV valve closure. AV valve closure. And I hope you know what you mean by AV valve, what you mean by atria, ventricle. We have all learned those things, right? So for simplification, let's make the heart over here. Right. So suppose this over here is one valve that is between the atria and ventricle, that we are going to call as AV valve or atrioventricular valve. Atrioventricular valve. On the other hand, we do have the pulmonary artery and aorta, which is coming out of it, out of the ventricle. So what is going to happen over here? I'm just drawing it. Okay, just give me a second. So I'm drawing it over here. Suppose this is the pulmonary and this is, so right atria, right ventricle, left atria and left ventricle. So over here, we are having two half moon shaped valves, and they are called as semilunar valves. Semilunar. Semi means half. Lunar means actually the moon. So they look as if it is a half moon shape. So that's why they are called as semilunar valves. Okay, what are the semilunar valves? They are the pulmonary and aortic valve. And what are the valves which are present between the atria and ventricle? They are atrioventricular valve, which we are going to call it as AV valve. Okay, atrioventricular valves are mitral valve on the left hand side and tricuspid valve on the right hand side. Right? So that is going to be our four valves which are going to be there. Now, first thing you have to remember, that is nothing but the AV valve closure is going to make first heart sound. And we know from first heart sound to second heart sound, we do have systole. And there is a fun fact over here. What is the fun fact? See, semilunar valve. S, it starts with S, right? And whenever we are writing second, so let's say second heart sound, right? In that also S is there, right? So S for second, S for semilunar valve. And the first funda is still applicable, that opening of the valve are never going to make the sound. Only the closure of the valves, they are going to make the sound. So that's why the second heart sound is going to be because of what thing, bacho? The second heart sound is because of the SL valve closure. Semilunar, I'm going to use the shortcut that is SL. So whenever I'm writing SL valve, that means it is the semilunar valve. Okay, so it's not visible over here. I'm writing somewhat upward. So semilunar valve closure. So first thing we are clear with that it is going to start with the AV valve closure and it is going to end. The systole is going to end at the SL valve closure, right? Yes, Manja, you're absolutely right. Okay. Offline classes, yes, bache, we do take offline classes also. Yes, early. Now let's come in early. I hope you know what do you mean by systole. Systole literally means contraction. So what is going to happen? We are now going to contract the ventricles. But understand what happens in the heart is, I'm just making it again. Suppose let's make one side of the heart. Suppose this is the atria and suppose this is the ventricle. And this is, let's say, it's a left atria, left ventricle, and let's say this is the aorta. Now, can you tell me what is the pressure in the aorta and what is the pressure in the ventricles during the diastole? Yes, guys. What is the pressure in the ventricle and what is the pressure in the... I'm going to make it over here till the time I get reply. tell me what is the pressure in the diastole in the left ventricle and what is the pressure in the aorta when the ventricles are in the diastole. Yes, please. So I'm going to write like this: left ventricle and aorta. What is the pressure in the systole? What is the pressure in the diastole? Over here again, systole and diastole. Yes, guys, tell me what is the ventricular pressure in the systole and diastole? All right, so I guess there is a lag. I'm going to move ahead. I'm waiting for the diastolic pressure in the ventricle because I want that answer from you guys also. Fine. In the aorta, I'm going to tell the values till then. So it is going to be 120 mmHg and 80 mmHg in the aorta. 80 mmHg in the aorta. What about the ventricles? What about the ventricles? Yes. Manzar Ali Khan, I got your answer. Okay. So systole mein, it is going to have 120 maximum pressure, that is 120 mmHg. And what is the pressure during the diastole? It is, remember, 0 to 4 mmHg and not 80 mmHg. Student, do mistake in this, but please remember it is going to be 0 to 4 mmHg. Otherwise, what is going to happen? The LA pressure is around 10 to 15 mmHg maximum during the systole. And if there is no pressure gradient, the filling won't take place. And that's why we want almost 0 mmHg pressure during the diastole in the left ventricle. So I'm going to close this valve right at the start of systole. And this valve is also closed. I'm not yet opened this valve. That means both the valves are closed. The AV valve also and the SL valve, both the valves are closed. Now what is going to happen? See over here. Let's say during the filling, when the heart was filled with the blood, it increased somewhat pressure, but it won't cross the 80 mm pressure, right? So let's say in the aorta, we are having how much pressure? Let's say in the aorta, we are having 80 mmHg pressure, okay? And these are the valves. What do you mean by valves and how they are different from the sphincter? Remember, sphincter is both way valve, okay? So it is a door, both are the doors, but the sphincter are the type of door which can allow the flow in both the direction. Suppose this is the sphincter, this is a, let's say, vessel or intestine, and there is a sphincter. It will allow the flow in both the direction. But that is not in the case of valve. Valve will allow only unidirectional flow. Unidirectional flow, okay? There is some lag, Manzar, okay? So unidirectional flow is there. And remember, so that's why what is going to happen? Whenever the left ventricle is going to have more pressure, then only these valves are going to open up. But if the aorta is having more pressure, they will rather close more and more. They will come closer more and more. And that's why they won't open if the aortic pressure is higher. So to open the semilunar valve, we want more pressure in the ventricle. How to build this pressure? So please remember that we are going to start contraction in the ventricle so as to build up the pressure, right? But both the valves are closed and the volume is not changing. If volume is not changing, the volume is same. For the same, we use the word iso, and that's why the contraction is going on, but there is no change in the blood volume. Neither the blood is coming into the ventricle, nor it is going out of the ventricle. Suppose via the filling, the ventricle had a 10 mmHg pressure and it start contracting. As soon as it will start contracting, it will build up the pressure, let's say 20, 30, 40, 50, 60, 70, 80. As soon as it becomes 81, what is going to happen? The valves are going to open up. Why? Because now at 81 mmHg pressure, as soon as the ventricular pressure is more than aortic pressure, the valves are going to open, that is the SL valve open. And we are talking about the left ventricle. That's why, remember, it is going to be the aortic valve which is going to open up, right? And the contraction which was happening in this period, in that time, there was no change in the volume. That means volume was same, but the heart was contracting. So that's why this phase will be called as isovolumetric contraction. So always remember, first of all, whatever be the phase, either it is systole or diastole, it is going to be the iso first, and then there is going to be volume change. Now, what is the volume change that is going to happen? What is the volume which is going to happen? Volume change that is going to happen. Now, I told you that during the contraction, ventricular pressure shoots up and that becomes more than aortic pressure. So that is why what is going to happen over here? The ejection will start. Now, the ejection is going to start of the blood. Why? Because the ventricular pressure is more now. And that's why we will start the ejection of the blood. The muscle is contracting and there is an active ejection. Why? Because whenever we are going to contract the muscle, we're going to use the energy. And whenever we use the energy, we call that process as active, right? So that's why what is going to happen over here, the ejection will start. In both the phases, the ejection is going to occur, but there is a difference in the mid phase also, and in the late phase of systole also, the ejection is going to happen. But what is the difference? In the first, that means in the mid-systole, whatever ejection is happening, that is known as early ejection. Remember, this is not early systole, it is early ejection. And the ventricular muscle is contracting. That's why we are going to call it as active or passive. Obviously, active ejection. And this is going to be very, very rapid. Why? Because there is a lot of pressure gradient which is going to be present in between the ventricle and aorta. And that's why it is going to be called as rapid ejection also. It will be called as rapid ejection also. Right? So I hope till now everything is going to be right. Till now everything is fine. Yes. Mohbant Sadiq, you're right. Dr. Sonar, just try to be attentive. It is of 1 to 2 hours of session, right? Yes, it might be present in the Cerebellum app for some time. Dr. Sonar, yes, it will be there for some time. I'm not sure for how long, but it will be there. Okay. And then coming on to the how much volume will be ejected over here, please remember 2/3 of the volume is going to get ejected. And just before the mid phase, the SL valve is going to open up, because if it is not open, definitely the ejection won't take place. So AV valve, first of all, it was closed, then the SL valve open, ejection will start. First of all, the early ejection will occur, and in the early ejection, the ventricles are contracting. That's why we call it as active ejection, isn't it? Then, if there is an active ejection, there must be passive ejection also. So write down the second one is the late ejection. It is going to be the late ejection, or this is also called as the passive ejection. And this is going to be slow. Now, whenever you go in a vehicle and suddenly something comes in the front, what the driver is going to do? Driver is going to put the brake. As soon as he put the brake, what happens? Our body falls forward and then we will maintain our posture back again. Why we go in the front? Because the vehicle was in the motion, our body also came in the motion. And whenever the vehicle has stopped, but our body was still in the motion. Why? Because of the momentum, and the same is going to go with the ventricle. So remember, because of the momentum, thank you, Teju. So because of the momentum, what is going to happen? Because of the momentum, in the late phase of ventricular ejection, the ventricle is still going to eject the blood. Remaining 1/3 of the ejection is going to take place in the late or passive or slow kind of ejection. So please make a note of it. So that's why the ejection will be complete over here, and as soon as the ejection is over, now the ventricle will start to relax. And as soon as the ventricle will start to relax, now the blood has gone outside and the ejection, the work of the ventricle is over now. Now the ventricle, what it is going to do? Its work is over. As soon as the class is over, you take a sigh of breath, right? So you will be happy. Why? Because the class is over. You have attended the class. You're happy with your work done. So same happens with the ventricle. The ventricle is also going to relax now. So as soon as ventricles start to relax, what is going to happen to the ventricular pressure? The ventricular pressure is going to fall back again, right? So ventricular pressure start to fall, but the aorta is still maintaining the pressure. How much? 120 around, right? So what is going to happen as soon as the late ejection is over, the ventricular pressure is going to be lesser than the aortic or pulmonary pressure, depending on which ventricle we are talking over here. We are talking about the left side. That's why I'm writing over here the aorta. Right. After this, what is going to happen? The ventricular pressure, I'm just writing ventricular pressure. I hope you can see that, is going to be lesser as compared to the aortic pressure. Aortic pressure. And that's why the semilunar valve will close. And as soon as semilunar valves are closed, which sound will be there? S for semilunar valve, S for second heart sound. So please remember, our theory and our mnemonic are going to be valid over here, right? So we discussed already that the SL valve is going to make S2 sound, and hence we completed the systole. Right. So let's move on to the next thing, that is going to be the diastole. Diastole is a little tricky, but we are going to make it easy also. Okay. I hope you understood this. Let's move on to the diastole. And we know diastole is from S2 to S1. It is from S2 to S1. So we are going to go from S2 towards S1. Again, we are going to make 3 parts of it. Can you tell me when the S1 sound comes? Kindly give the comments in the YouTube itself, whomsoever joined with the Zoom. I cannot see the comment because of some technical error. Kindly do the comments in the YouTube itself. Okay. Fine. So again, we are going to divide that into early, mid, and late phase. And over here, it is going to be early diastole, mid diastole, and late diastole. If I want to say the murmur is present in whole of the diastole, that is known as pan-diastolic murmur. So if I'm saying pan, that means whole of the systole. If I'm saying pan-diastolic, if I'm saying pan-systolic, that means whole of the systole. During whole of the systole, there is a turbulence. Something is going wrong. Okay, in the whole of the systole. All right. So let's discuss. Let's discuss what is going to be there in the early, mid, and late diastole. Can you tell me when the S2 sound comes? Just now we discussed that the S2 sound is going to come whenever there is SL valve closure. SL valve closure, I told you, never make a mistake that the opening will make the sound, okay? Only the closure is going to make the sound, okay? Fine. So what is going to happen as soon as the SL valve close? But there is again a trick. What was the trick? I told you that the heart start to, let's say this is the left atrium again, left ventricle, and this is the aorta back again. The ventricles start to relax, and then the SL valve close. Now remember, there is a slight delay, right? As there is a technical issue, technical error which is going on, technical delay which is going on. So same is going to happen over here, that it will take some time to close the SL valve, but still the ventricle already start to relax, right? So what is going to happen? there is the relaxation which started before the SL valve close. What we call it as? We call it as protodiastole. Pro means early, right? Just before the diastole. So we are going to call it as protodiastole. Now remember, the protodiastole is for 0.4, not 4, that is 0.04 seconds. It's a fraction of time, but yes, with that time, what is the importance we're going to learn later on. But remember, there is a phase of this diastole, which was not there in the systole. Right. So first of all, before the closure of the SL valve, just before the closure of the SL valve, if you have space above, just write there that the protodiastole is going to come, and that is the first phase of the diastole. Please remember, protodiastole is the first phase of the diastole, which is for just 0.04 second, but it is there. Okay, then what is going to happen? The SL valve will close as soon as the pressure is sufficiently low in the ventricles as compared to the aorta. The SL valve is closed. Now, still the AV valve is closed. So what we need to do? We need to decrease the, so suppose over here, now the SL valve is closed. AV valve was also closed. I'm just changing the color so that it will be visible more properly, right? I'm going to make with this color. Now, I have to open for the filling. Now the heart start to relax. In the relaxation, I want the ventricles to get filled. For the filling, I need to open up the AV valve. Now, if I have to open up the AV valve, what should happen? The ventricular pressure should be lower than the atrial pressure. Not aortic pressure, but the left atrial pressure, LA pressure. So LA pressure, whenever it is going to increase, then only, or we can say whenever the ventricular pressure is low, then only the AV valve will be open. So yes, as soon as the heart start to relax, that means the ventricles start to relax, what is going to happen? The pressure will fall. As soon as it goes below 10 mmHg, what is going to happen? The AV valve will open. But till that time, the ventricle has to relax sufficiently so as to get that lower pressure possible. That means when both the valves were closed, still the ventricle was relaxing and there is no change in the blood volume. So what is going to happen over here? What this phase will be called as? Yes, please. The volume is same and the heart is relaxing. The ventricles are relaxing. So please remember, it will be again called as isovolumetric. But we are talking over here about the diastole. That means the ventricles are relaxing. So we are going to call it as isovolumetric relaxation. Isovolumetric relaxation. Now, when the isovolumetric relaxation is sufficient, which valve will be open? The valve that is going to open over here once the ventricular pressure is lower than the left atrial pressure. What is going to happen? The AV valve is going to open. AV valve is going to open. Can you tell me which is the AV valve? Yes, Sadiq, you are right. Which is the AV valve? Yes, Manzar, superb. So which is the AV valve? Which is going to be there in between the left atria and left ventricle? Please let me know in the comments. I'm waiting for your reply. Which is this valve which we are opening right now? Yes, please. As soon as this valve is open, what is going to happen? The filling of the ventricle is going to start. That means the LA is going to do what thing? It is going to cause the blood filling into the ventricle. The blood is going to get filled into the ventricle. And that's why we are going to call this phase, the mid and late phase, as the filling phase, right? But what is going to happen? Again, we are going to make two different types of filling. Okay, what are the filling? Early and late again. Early and late phase. So I'm going to write early and late filling. Now remember, there is one fact over here that you have to remember, that which one is active and which one is passive. Usually in the sitting position and in the standing position, first thing that is going to help the filling, that is the gravity, which is going to act. Usually the ventricles are downward, and I hope nobody is having ventricle upward and atria downward. That is going to be a major kind of a mutation, right? Usually what happens, the ventricles are below the atria and the gravity is going to help us. In the supine position, what is going to help us? The pressure gradient. That means the pressure difference between the left atrium and left ventricle, or right atrium and right ventricle, that is going to help us in the filling of the ventricle. As soon as the filling of the ventricle starts, that means these two things, first is the pressure gradient and second is the gravity. Because of these two things, does the atria need to contract over here? No, because of these two things, the blood, whatever blood is there, it is going to come automatically into the ventricle. That means the atria is also chilling out, right? So it is not contracting. So that means this is going to be the passive filling. So this is passive filling because of the pressure gradient and gravity. The filling is automatically occurring. The atria is not contracting, right? So this is known as passive filling, and this is going to be rapid. Now, understand, in the late filling, what is going to happen, that we'll see. But before that, what happens in between is very, very important. What is going to happen in between of these two? For sometimes there is no movement of the heart, and that means none of them are contracting. Neither the left atrium nor the left ventricle are contracting, and the blood flow is decreasing. That means the flow rate is going to decrease, and that's why it looks as if the heart has stopped in the diastole. Stoppage, for that we use the terminology stasis, and it is stopped in the diastole, and that's why we are going to call it as diastasis. Wow. So there are two extra phases that we are going to learn. First was the protodiastole and second is the diastasis. Diastasis, it looks as if the heart has stopped in the diastole. What is the significance of this diastasis? Please remember that the diastasis phase is longest phase available in the cardiac cycle. What is the shortest phase? You are going to answer me. Okay. The longest phase is diastasis, and there is no much of the movement of the volume also and of the left atrium and ventricle. So it is the best phase. Whenever we want to check something in the echo, let's say what is the condition of the heart valves or the thickness of the heart myocardium. So this is the best phase. So what is the best phase for echo? That is going to be diastasis. Echo is nothing but the ultrasound of the heart. Okay. So when the heart is stable at this phase, this is going to be the best phase to analyze the structural properties of the heart. Okay. And physiologically, it is going to be the longer phase, which is going to be available. In that, some amount of blood is going to go into the ventricle. It's not like there is no amount of movement. Movement is not there of the left atria, but remember, due to gravity and pressure gradient, slow filling of the ventricle is going to occur, very, very less, but yes, slow filling of the ventricle is going to occur, right? And these two combinedly form around 80% of the filling. 80% of the filling, which is clearly written in the genome. These two phases combinedly, they're going to cause 80% of the filling. Remaining 20% of the filling of the ventricle occurs in the late phase. Now, most of the pressure gradient is over during the slow filling. What is going to happen? That if the filling has been the gradient has been over till the slow filling, then I still have to do 20% of the filling. For that, I need more of the pressure. So what I can ask to the atria? To contract and build up more pressure than the left ventricle. As soon as the atria start to contract, it is no more passive filling, it becomes active filling. So please remember, the atrial systole is going to occur at the end of ventricular diastole, right? So suppose this is the atria, suppose this is the ventricle. It never happens that both contract at the same time and both relax. It never should happen. Atria contract at that time, the ventricles are relaxing. When the ventricles are contracting, the atria is relaxing. So the simultaneous, the alternative movement is going to go on, right? And hence we are proving over here that at the last phase of ventricular diastole, the systole is going to happen in the atria. And since the atria is contracting, the muscle contraction requires energy. The late filling will be called as active filling. And this is going to be also rapid. So there are two rapid phases. This is known as first rapid filling, and this is known as late rapid filling. Okay, this is known as late rapid filling. And remaining 20% of the filling occurs in this phase, right? Then as soon as the filling is over, now the atria will start to relax and the ventricles are still like that, right? So what is going to happen? As soon as the atria will start to relax, what is going to happen, guys? The left atrial pressure start to lower down as compared to the left ventricular pressure. As soon as that happens, what is going to happen to the AV valve? The AV valve is going to close, right? This is going to close. So there is no more filling. And as soon as the pressure of the left atrium falls below the left ventricular pressure, definitely the AV valve is going to close. So write down over here that the left atrial pressure, since as soon as the filling is over, the atria will start to relax. And because of that, the left atrial pressure is less than left ventricular pressure. We all know the valve will close, and that is nothing but the AV valve closure. A is the first alphabet, and we know if the first alphabet is there, that is going to make a sound, that is going to be S1 sound. Okay, so these are the phases. Again, let's quickly revise what are the systolic phases and diastolic phases. In the systole, you have to remember only 3 phases. What are these 3 phases? First is the isovolumetric contraction, and second is the early filling, third is the late filling. That's all. The systole is over, right? But in the diastole, on the other hand, you have 5 different phases. What are the 5 different phases that we read? First is the protodiastole. Second is the isovolumetric relaxation. Third is the early rapid or passive filling. The fourth is going to be diastasis. And fifth is going to be the late active or late rapid filling. Okay, so these are the 5 different phases which are there in the diastole, Okay, till here, I hope everything is clear, because as soon as we are going to go forward, this is the easiest part. You know, as soon as we are going to move on forward, definitely it is going to get tricky, not tough, but tricky. But we have the way out for everything, right? So let's see what comes next. If in exam it comes, you can draw these 3 circles and you can show it like this, right? Or what you can do is you can divide the circle into 8 different parts like that easily. Okay, and I'm going to make 1 circle inside. It takes only 5 seconds, 2 to 5 seconds to make such circles, but it is going to give you 1 or 2 marks because you're going to impress the examiners, right? 1, 2, 3, 4, 5, 6, 7, 8, right? So there are 8 parts which are there. Now inside I'm going to write atrial systole, right? So AS means atrial systole over here, and rest of the phases is going to be the atrial diastole. Inside, rest of the phases are going to be atrial diastole, except this, I'll just color it up in the green color. This is the atrial systole. Rest phases are atrial diastole. And I'm going to color another color over here, that this I know is going to be the ventricular systole, because I know that the end of ventricular diastole, the atrial systole comes, right? So this is going to be, the yellow color is going to be ventricular systole. And rest of it is going to be, rest I'll color in the different color. That is going to be, yes, please, this color over here is going to be ventricular diastole, right? So it took me around 1 minute. Since I'm explaining it, your handwriting should be good, right? And must be good. And in the exam, you're writing it quickly, you make it quickly. So it takes almost 30 seconds, but those 30 seconds are worth it if you make it correctly, right? So same, which is given in the different color format, and they're not divided into different segments, but we can divide it into different segments and impress the examiner. We know how to get extra marks than other students, right? So this is going to be the trick to get extra mark. It is going to fill up your page also. You have done something very, very correctly. You are telling the examiner that we have read properly, right? So let's move on forward. If you want to make a somewhat complicated diagram, and if you have time, let's say it's the test which is going on, so you can make it. Now, I do not want you to remember or recall all of these things, just that few things you have to remember. First thing is the shortest one. I told you already that it is going to be the protodiastole, right? And I told you there is a longest phase. You can see over here, 0. Everything is less than 0.1, only except the diastasis. In the size also, you can see that it is taking the largest part, right? So the longest is going to be the diastasis. Okay, so that is the significance. And I told you in the 2D echo, that is, if you want to see the condition of valve, or you want to check the condition of endocardium, myocardium, pericardium, this is the best phase. Why? Because the heart movement is minimum, right? So in the applied aspect, you can write, since the integrated learning is going on, so you have to write the applied aspect of diastasis. Please make a note that you can write that it is the least movement which is going to take place, and movement is going to occur in the heart, and that's why it is best for the investigations. I'm just writing like that, investigations such as 2D echo, which is going to be a video recording which we are doing with the help of the ultrasound, right? So it is not giving any side effect, but yes, definitely it is going to be helpful. That's all I want to remember. I want you to remember rest of the things we have already discussed. You can write it on your own. The IVR means isovolumetric relaxation, rapid filling phase, diastasis. This is going to be the second rapid filling phase, right? Or late rapid filling phase. And this is going to be isovolumetric contraction, rapid ejection, slow ejection. That means this is the systolic phase, right? Let's move on. Now, I want you to see this video over here, which I had for you. Okay, see over here what they're showing. I hope you can see that. What they're showing. See carefully, they are correlating it with the ECG. It is correlated with the ECG, and in the inner circle, as we have drawn, atrial systole was shown, and at the outer circle, the inner circle, I cannot write on this, I hope. Okay, this inner circle is showing atrium. On the other hand, this outer circle is showing the ventricular phases, right? So what you can see, the inside the atrial phases are there, and outside the ventricular phases are going to be there. And see how the ECG waves are moving forward and how the mechanical changes are happening in the ventricles as well as atria. Okay, so that is the thing which is we are going to learn and we are going to make on our own, right? So graph, you should make the graph. Yes, guys, you have given the answers. Mohammad Sadiq, yes, you're right. Manzur Ali Khan, Ritik, yes, you guys are absolutely correct. Teju, there are other faculties more experienced than me in their own subjects, right? So trust me, you're going to love their subjects also, right? Let's move on. So the next thing is every beat matters, right? So can you guess what we are going to discuss next? Yes, guys. What we are going to discuss, the next thing that we are going to discuss is the beats, right? So the beats are going to get discussed and, So that we are going to discuss. And let's move on to the beats. Okay, so we are going to discuss ECG wave in a short format, whichever is required. ECG itself is a big lecture of 2 hours, right? But we are going to just discuss what is relevant for us in the cardiac cycle. So we all know there are 3 main waves, which we are going to draw it over here. That is, first wave is going to be our cute small wave, that is P wave. Then QRS complex. And somewhat taller than the P wave is going to be the T wave. So P, QRS, and T wave. Please remember, everybody knows this, that the P wave is because of atrial systole, or we can write atrial contraction. Now, we cannot write the atrial contraction since this is the wave, which is the electrical activity of the heart, right? After which the mechanical will come. So it is going to be atrial depolarization. Atrial depolarization. QRS complex shows the ventricular depolarization. Ventricular depolarization, and T wave shows the ventricular repolarization. Repolarization. Can you tell me where the atrial repolarization has vanished? Yes, guys, where the atrial repolarization has vanished. Yes, you guys are absolutely correct that it is gone behind, or it is hidden behind the QRS complex. When the ventricle depolarizes at that time, the atria should repolarize. Why? Because the depolarization will be followed by which mechanical phenomena? Systole. That means atrial systole will be followed by the P wave. The ventricular systole will be followed by QRS complex, and the ventricular repolarization, remember RE for re, which will be followed by ventricular relaxation, and that is nothing but the diastole, right? That is nothing but the diastole. So it will be followed by the ventricular diastole. So the diastole will start from here. Okay, so that is the case. Now, if I have to say that how the cardiac cycle is going to go, then I'm going to talk about the systole, when the systole of the ventricle is going to start. So I'm marking it over here. Remember, the systole will start after the R wave till the ventricles has fully repolarized. So ventricular systole till the diastole will start. So diastole starts somewhere here. So till this point, it is going to be the ventricular systole, right, which start after the ventricular depolarization. You guys are lovely, right? Thank you for interaction which is going on, right? And then the ventricular diastole will come in the rest of the phase. That is going to be from here. I know that it is going to be longer. That means it will come from the T wave till the next P wave. So whole of this time, there is going to be ventricular diastole, which is going to come, right? So this is how we are going to correlate everything. Now, till this point, we have just correlated the mechanical and electrical activity. Let's add up some music, right? That means let's add up some sounds also over here. So yes, let me interpret what your heart says. That if someone sees you like this, please draw this diagram. Rather than doing any Bollywood bullshit, we can do the memes on our own medical terminology, which only we medicos can understand, right? So let me interpret. So let's interpret what your heart is saying. For saying, we are going to add up the sounds, heart sounds. Till now, we have read about S1 and S2 sound, right? But I told you that there are 4 different types of sounds which are going to be present, right? So let's learn about them. So what your heart says, it says S1, S2, S3, S4. Whenever we ask in the Viva, what are the heart sound? They say loved up. Please don't say that. Okay, loved up. The heart won't say loved up. It is the sounds that you have to answer in the Viva. That is S1, S2, S3, and S4. We have already discussed one, which is the first alphabet, guys. Yes. S1 and S2, you guys are going to tell me what is the S1 and S2. We have already discussed, and as you guys are telling me, yes, this is the AV valve closure. Because of that, why? Because the A is the first alphabet over here, S for second heart sound, and S for semilunar valve closure. Opening will never make a sound, rather the closure will make the sound. Now, for simplification, I'm writing like this, because it is going to help us in the remembering purposes. F for filling. Please remember, the third heart sound also come in the filling, and fourth heart sound also come in the filling. Whenever you turn on the tap and fill your bucket, it makes sound, right? So same, remember that the ventricle acting as a bucket and the atria is acting like a tap, water tap or something like that. So that is going to make a sound. Remember, there are two phases of filling: early filling. Rapid filling night is going to make a sound, because in the diastasis we are not going to hear anything, because there is a least movement. And if there is a least movement, turbulence will be also low, and that's why we won't be able to hear anything in that phase. So in the early rapid filling and in the late rapid filling, we are going to hear S3 and S4 sound there. Okay, so S3 and S4 sounds are going to be heard in the early rapid and late rapid filling. Okay, so we are going to cover all these topics in a one chart. I'm going to show you. Don't get scared. You have to make it. As soon as you practice more and more, definitely you are going to get the sound. I'm writing it over here, S4 sound. Okay, late rapid is going to make S4 sound. So that is all about the heart sound. That is what your heart is going to say. Now, if I have to correlate that with the electrical activity, let's give some shock and sound effect together, right? So electrical activity is going to be a shock, right? So P wave, again, I'm going to make QRS complex. Q is always not seen. Then also it is normal. So understand, if I make it like this, the S1, where it is going to come, I know the S1 sound is going to come whenever the systole will start. And where the systole starts, whenever the depolarization of heart is over. That means at QRS complex, at R, I'm going to see over here somewhere, I'm going to hear the S1 sound. And whenever the repolarization is over and relaxation is starting, that is the mechanical phenomena, that means diastole is starting, somewhere here at the end of the T wave, I'm going to hear S2 sound. All right, S3 sound, just wait for it. S3 will cover, but remember S4 sound will be heard, because late rapid filling is going to start whenever the atria gets contracted, and that's why the atrial contraction will start after the atrial depolarization, and that's why the S4 sound comes over here, and in between the S2 and S4 we are going to have S3 sound somewhere here, right? Now, in the exam, we don't have that much time to recall everything, and our mind is already stuck up somewhere, right? Recalling another question's answer. So how to remember? I'm going to tell you the trick. You're going to find it nowhere. Then here, remember how to remember which sound is going to be there. Just remember the amplitude of wave. What you are seeing over here is the amplitude of QRS is the largest. So that's why the first number we are going to give to the S1. So S1 is going to be heard after QRS complex. So yes, we are going to remember like that, after QRS. So we are going to correlate these very, very easily. What do you think? What is the second largest wave in the amplitude over here? Of course, T wave. So that's why after a T wave, what we are going to have? the second wave. Second number goes for the high jump that has been made by the T wave. And the S3 is going to come in between the S2 and S4. So we are directly going to go for the S4. I'm just writing it over here. S4 is going to occur after a P wave. That is only wave left over here. U wave is usually not seen, and S3 is going to come in between S2 and S4. S2 and S4. Isn't it easy? Very easy. And please mark it that it is going to come as a long question, right? So that's why it is very, very important to correlate these things, not only in your prof exam, but this is going to help you in your MCQs also, which you must be preparing for your entrance examination, right? Let's move on. If these are clear, then definitely you are good to go for the next year when you are going to read all the murmurs. This is going to be very, very helpful how you can diagnose the patient, right? Let's move on forward. What are the differences you can see over here? Obviously, in the systole, it is going to make more sound, so it is going to be louder. The S1 is going to be louder. Less frequency, high amplitude. Loud means amplitude that we are going to measure. And whenever the amplitude increases, usually the frequency lowers down, right? For example, there is one wave. Suppose this is, let's say 1 second or 10 seconds. So whenever I'm going to increase the amplitude, only 2 waves came over here. But whenever there is a low amplitude, I can make many, many waves. So how many waves are there? That is frequency. How much height of those waves? That is going to be the amplitude. So louder will be the S1. That means high amplitude, less frequency, and softer will be the S2. That is nothing but the less amplitude and high frequency. This chart we have made on our own already, right? So after QRS, there will be S1. After T wave, there will be S2. S3 is going to be there. And after P wave, there is going to be S4. We have made it on our own, and that too very, very nicely, very accurate. This diagram is not very accurate because I have taken that from the net itself, but yes, whatever we had made, that is accurate. Let's move on to the JVP, right? So let's move on to the JVP. I hope everything is clear. Any doubt till now, you can just message me in the chat box, guys. Right. So let's go on in the jugular vein. Now, if I have to measure the, let's say, mean arterial pressure, I can take average of it. Or if I have to make aortic pressure, I can put the pressure transducer on the aorta and I can measure it. But that is not in the case of venous pressure. Why? Because there are two different vena cava carrying different volumes and having different pressures. So I cannot just average them out. So what I can do is, I can measure the pressure of right atrium. And please remember, the right atrium is also called as central vein. But to have the transducer and put it into the right atrium is going to be a bit difficult. So we have found a way. What is the way? Remember, between, suppose this is the right atrium and this is the jugular vein. There is no door in between. That means there is no valve in between. So if there is no valve in between, there is no obstruction. If you increase the central venous pressure, the jugular pressure automatically raises. And vice versa, if you decrease the right atrial pressure, the jugular venous pressure also decreases. And hence, we get to know that, yes, via measuring the jugular venous pressure, which is going to be much, much easier as compared to the measuring right atrial pressure, we are going to put the pressure transducer onto the jugular vein, and that's how we are going to measure the central venous pressure. Why? Because there is no valve which is going to be present in between the right atrium and the jugular vein. So with this concept, let's move on. It's like this, that if the layer is going to raise over here, it is going to raise here also. So remember this diagram, and remember whenever they are going to ask you the JVP. So jugular venous pressure, we are going to again correlate that with the cardiac cycle. Let's see first of all, what are the waves that are seen. The only concept that you have to remember over here is that whenever the pressure inside the jugular vein raises, what is going to happen? That is going to give us the upstroke in the whatever CRO that we are using. Okay, so in the pressure transducer, when we are attached it to the computer, it is going to give a positive, that means upstroke, positive wave, that is upstroke is going to be given whenever the pressure is higher, right? So let's start with the atrial contractions. Whenever we are going to make the JVP wave, they will look something like this. Now, they are going to have 3 waves and 2 descents. Okay, so they are going to have 3 wave and 2 descents. What are the 3 wave and 2 descents? So there are A wave, C wave, and V wave. And there are 2 descents. That means the downward slope, that is X and Y descents. Okay, so wave, whenever there is an upstroke, that means whenever there is an increase in the pressure, I'm going to write it as wave. And descents, whenever there is decrease in the pressure, I'm going to write it as descents, right? That is, there are 2 descents, X and Y, and 3 wave, A, C, and B, in which there is going to be increase in the right atrial pressure, central venous pressure, or jugular venous pressure. P is for P, pressure, jugular venous pressure, central venous pressure, or right atrial pressure. Okay, how to remember? First of all, let's see that. You have to remember A for atrial systole. So please remember over here, A comes whenever there is an atrial systole. So whenever the right atria is going to contract, what is going to happen to the pressure? The pressure is going to raise, right? The pressure is going to increase, and that's why we are getting the upstroke over here. So atrial contraction or atrial systole, I'm writing over here. Atrial contraction or atrial systole, that is right atrial systole, is going to give me the A wave. Now what happens? As soon as the atrial systole is over, the atria start to relax. When it start to relax, which phase must be going on in the ventricle? Ventricular contraction will start, but there are no valves open. That means it is isovolumetric phase. Now what happens in the isovolumetric phase? That the ventricles start contracting, but the tricuspid valve is closed and the SL valve is also closed, and the pressure is building up. That's why the tricuspid valve, suppose this is like this, it bulges into the right atrium. As soon as it bulges into the right atrium, the pressure transducer measure it as the positive wave or increase in the pressure. There is a slight increase in the pressure in the right atrium. So that's why this is going to give us the C wave. So please remember, C wave is because of IVC. That is nothing but the isovolumetric contraction. And why it is there? What is the reason? TV, that is tricuspid valve. I'm writing over here, tricuspid valve closure. TV bulges into the, this is closed already, so it bulges. So TV get bulges, or this is bulging into atria, right atrium. Why? Because we have pressure, apply the pressure transducer into the right atrium, in between the right atrium and jugular vein. So that's why, please remember, we are going to talk in terms of right atrial pressure over here. So the tricuspid valve, that is the atrioventricular valve, which is going to be present on the right side. So that's why it is going to get bulged and right atrial pressure raised. So that's why there is a positive upstroke. Now, as soon as the ejection start, what is going to happen? The TV valve will come down on its normal position, and that's why we are going to have downstroke. In that time, what started? The ventricles are contracting. That means the atria must be relaxing, right? The atria must be relaxing. So please remember, atrial relaxation. Atrial relaxation is going to cause X wave. So X for X, X is there in the atrial relaxation. So please remember, atrial relaxation is going to cause X wave. Coming to the V wave, can you tell me why there is a V wave? Please remember, V for V, that is venous return. What do you mean by venous return? The blood is returning via the venous system into the heart, that is known as venous return. Via the, let's say over here, I'm drawing the right atrium. Let's say there is inferior vena cava and superior vena cava draining into the right atrium. What they're doing, they're putting the blood, whichever came via the venous system, into the right atria. And as soon as the right atrium start to getting filled with the blood, obviously the pressure is going to raise over here. And because of the venous return, we are going to give a positive upstroke, that is nothing but the V wave. So please remember, venous return is going to give us the V wave, right? Then what happens after the venous return has made a proper pressure, develop proper pressure, and as soon as the ejection which was going on, that is over, the isovolumetric relaxation is over, the AV valve is going to open up. As soon as the AV valves open, what is going to happen? There is going to be atrial emptying, or we can say there is ventricular filling which is going to take place. Now, what is going to happen to the atrial pressure? As soon as the ventricular filling will start, what is going to happen to the atrial pressure? Since it is losing the blood into the ventricle, or it is giving up the blood, it is giving up the load that it had towards the ventricle. Obviously, the atrial pressure will decrease and we are going to get a downstroke, that is going to be the Y wave or Y descent rather, right? So Y descent is because of what thing, bacho? The Y descent is because of, remember, it is because of the atrial emptying. So please remember, there is Y in the emptying and Y descent is because of the emptying. Venous return starts with the V, so that is also there, right? Atrial contraction, don't get confused between anything else. It is the atrial contraction which is going to happen, which is going to give us the A wave, right? So atrial emptying, atrial relaxation, venous return, all these things you have to remember. Just one thing, that is the TV valve bulges into the right atrium, that you have to remember on your own. That is the only thing you can do for me, right? To remember these things. I hope you guys are enjoying this session. Please let me know in the comment box. All right. Let's start with the another thing, that is going to be the correlation with the cardiac cycle. That is the thing which we are doing over here. So let's correlate that with the wave. Now I'm going to make it in the black color. A wave, C wave, X descent, V wave, and Y wave. Okay, so A, C, X, V, Y. Right? Now, understand, when the atrial contraction is occurring, when the atria contracts at the last phase of filling, right? That was the active filling, right? So over here, because of the late filling, late rapid filling, we are going to have atrial contraction, isn't it? So this upstroke is because of the atrial contraction. In that case, what is happening in the ventricle? That is the late rapid filling, isn't it? So that's why we are going to have the E wave. Now coming to this X, this is whole thing is X. Now remember, in some books, it is written as X and X dash. Okay. So what is this X? And this is known as X dash. What happens in the X? There is atrial emptying. And whenever the atria is going to empty over here, but before that, what should happen? Before the atrial contraction is going to take place, after the C wave over here, this is because of the atrial emptying. That means, atrial relaxation that is happening. Atrial emptying is over. In the A phase, the atrial emptying is over, right? So the atrial relaxation is happening over here. That means ventricle must be contracting. Ventricular contraction must be there, right? And ventricular contraction, when it happens, whenever there is ejection, right? And just before the ejection, we know there is going to be isovolumetric contraction, which is going to take place, right? So X is going to correlate with the atrial relaxation and isovolumetric contraction. Whenever this is going to happen, we are going to get the C wave. Now, the C wave is because of the tricuspid valve bulging. But that bulged valve should come down also, right? As soon as the SL valve is going to open, what is going to happen? Whatever ventricular pressure is building up there, that is going to get represented in the atrial system, and the venous system is going to have lower down the pressure. The tricuspid valve will come back to its normal position. So over here, understand this X dash denote PV valve, that is tricuspid valve, comes to its normal, come down to its normal position. And for normal, I don't have space over here, so I'm writing like this. X dash is because of the TV, that is the tricuspid valve, will come to its normal position. And that's why we are going to have this. And over here, what happens? The ejection will start. And this is why we are going to get the X over here, right? Now, coming to this, after the ejection, what should have come? The next is protodiastole and isovolumetric relaxation, right? When the atria is getting filled up, the ventricles start to relax, right? So that's why, please remember, there are two halves of it. That is, first is the isovolumetric relaxation, but just before that, we do have protodiastole first. So I'm going to write it over here. Proto-D, that means protodiastole, plus I'm going to have isovolumetric relaxation. Isovolumetric relaxation, right? And in the atria at the same time, the venous return is coming. Once this isovolumetric relaxation is over, which phase comes the next? It is going to be the first rapid filling, isn't it? So that is going to follow by this V wave, that is the first rapid filling over here, or early rapid filling is going to take place over here, which is going to be passive, and this is going to be active. Why? Because the atria is contracting just before the A wave, which is going to come, right? So this is how you're going to correlate the JVP with the cardiac cycle, right? I hope everybody is understanding. We see why. Yes. Okay. Let's move on to the next thing. So this diagram can be shown to you in the Viva. I remember that when this diagram used to come in the CVS, we are definitely going to have tachycardia, but you can correlate if you have the Guyton-Gedong, anything which is given, right? So you can correlate easily all the phases together, right? Atrial pressure, ventricular pressure, usually we talk in the pressure volume curves, right? You can see whenever there is a ejection which is happening, the ventricular pressure is rising, right? And it is rising from the zero. As soon as the ejection is going to happen in the aorta is going to follow the ventricular pressure. Okay, so you can correlate that. We are having less time, so we are going to discuss that in the volume and pressure curves, right? So till that time, what you can see over here, the volume is decreasing whenever the ejection is going to occur, and when the systole is going to start, as soon as the R wave is over, and it is shown that the S1 sound comes there, right? Who is the maximum amplitude wave? That is going to be the R wave in the ECG. And as I told you, please remember the amplitude. It is going to make your work easier, right? Not only the hard work, but the smart work is important in the medical field, because there is so much content. It's so vast that sometimes our brain just stuck on one thing. So that's why these smaller tricks are going to help you in the exam to get extra marks, right? So I have to show you one more thing, how to correlate that, right? So I'm just going to show, and sit back, relax, and see this video. So this is how your heart is going to look like, and it is going to beat, and accordingly, all these phases are going to come together, right? So I hope it is clear to you, because I'm having a clear view of it. And you can see on the right-hand side here, you're having tricuspid valve. There are 3 valves over here, 1, 2, and 3 at the back. On the other hand, on the left side, you are having 2 valves, 2 cusp of the valve, and that's why the mitral valve is called as bicuspid. And there is a AV valve on the right side, that is tricuspid valve. The cusp that is present, number of cusp onto that, the valves are going to given the name accordingly, right? So these are the phases which are going to take place. And I showed you one diagram, first of all, that this was the diagram. Obviously, in the exam, we don't have that much amount of time, and there is a lot of sympathetic activation. There is a chances that we will miss everything and make a mess out of it. So that's why I have made this easier for you. Even in the exam, if you can draw this diagram in the longer question, definitely mark my word that you are going to get 1 or 2 extra marks for drawing this diagram. And this is known as Vigor's diagram. When you correlate all the things in the cardiac cycle, this is known as a Vigor's diagram. The Vigor was the scientist who combined all the things together, right? And he made a diagram for us, and he made it so it should be easier to remember rather than making it. Okay, so please remember, at least you have to show all these things. Pressure in the aorta, you can show the pressure in the ventricle itself, just that the pressure in the aorta start from 80 to 120. Please remember that the ventricular pressure start from 0 and then it goes towards 120. That's the only difference in the pressure in the aorta and the ventricle. Right. And we have discussed all other things. Whenever you have time, you can just sit back and relax and do all these things, right? Just a recap, whenever there is a contraction, which will be followed by the depolarization of the ventricles. So please remember to draw the QRS complex just before the contraction point. All right. And whenever the ventricles start to contract, just before that, the atrial contraction will be over. So A wave should come just before the contraction. Just before the contraction, the A wave should come. Okay. And the C wave, it is the bulging, right? And whenever the isovolumetric contraction is going to occur first after the QRS complex. So just after the QRS complex, as soon as the isovolumetric contraction, this is the line where the isovolumetric contraction will take place. So please remember that to make the C wave in the JVP over here, right? Then comes the X descent. X, in that ejection is going to take place. You can just, for the memory purpose, you can write it like this, ejection. So you can remember that the X descent is going to come over here during the ejection period of the ventricle. All right. Then comes the venous return. When the venous return is going to fill the atria, at that time, the atria must be getting the venous return. So V wave will be there. Now remember, the relaxation of the ventricle is going on. And with that, the atrial relaxation is longer for 0.7 seconds. So some of that part is going to overlap, right? So that's why the V wave come after the S2, right? And in the relaxation. So in the first phase of diastole, the V wave is going to come, and this is going to do the filling. In the filling, late phase of filling, you're going to make the A wave. If you can try this, you can draw it. Otherwise, draw it separately, and whatever we have drawn on our own, you can draw it and you can get a good grades in the exam. All right. So that is all for today's session. I'm going to ask you the question, right? And you have to answer me in the comment box, right? So I'm looking at your comments as in the Zoom also and in the YouTube session also, right? So please give me the answers, whatever the question is shown on the chat over here or on the screen. I'm going to read the question for you, and then you can give me the answer. I'm going to wait for 30 seconds because yes, there is somewhat delay which is occurring, right? So the first question says that which of the following statement is incorrect except, so that means we have to find the correct statement, right? So whenever this is going to come, you have to do the reverse, that incorrect statement except, that means they are asking us what is the correct statement. So please read up and tell me what is the correct statement over here. First, A option is saying in isovolumetric ventricular contraction, the AV valves are closed while SL valve are open. Is it true? First heart sound occur after isovolumetric contraction phase of cardiac cycle. In a pregnant female, third heart sound can be heard during early ventricular contraction phase of cardiac cycle, and isovolumetric relaxation is also called as diastole proper. Diastole proper. Just tell me which of this is correct. So I'm going to just go on, right? Till that time, there's some lag. I hope you guys are going to give me the answer. Yes. So in isovolumetric ventricular contraction, so whenever the iso phase is there, please remember both the valves are closed. So if they are writing that one valve is open, that cannot be the correct answer. The SL valve should be closed. So it is incorrect option. First heart sound occurs after isovolumetric contraction. After isovolumetric contraction, there is ejection. So after isovolumetric contraction, ejection will happen, and in ejection there is no sound will be heard because one valve is open, and opening of the valve will, won't make the sound. Over here the SL valve are going to open, right? First heart sound comes before isovolumetric contraction whenever the AV valve is going to close there, right? So that's why this is also wrong option. In pregnant female, third heart sound is heard. Now remember the funda about third heart sound, that S3 is usually less than 20 hertz, but in the pregnant female there is increase in the blood volume. So yes, the S3 is heard. Why? Because it becomes more than 20 hertz. Why? Because there is much more amount of blood which is present, and that is going to cause the plasma, which is going to increase in the volume. And if you open up the tap, in the same time you have to fill the ventricle with the more blood, so it is going to create turbulence which will be more than 20 hertz, and we can hear the S3 sound. But remember, read out the full thing, that in the female, third heart sound can be heard. Till this point, it is correct. During early ventricular contraction. No, during early ventricular contraction, we cannot hear the S3 sound. The S3 sound is heard whenever there is filling going on. And during filling, what happens to the ventricle? The ventricle relaxes and not contract, right? So suppose this was the ventricle, right? So ventricle relaxes during the filling and not contract. So that is also incorrect, right? Isovolumetric ventricular relaxation, that is IVR, is also called as diastole proper. Why? Because the proper diastole start after that. Why I'm saying so? Because understand, protodiastole is the first phase, but we do not accept it as the diastole. Why? Because the SL valve is still not closed. Whenever the SL valve is going to close, then we say that the proper diastole will start, right? And that's why the IVR is known as the diastole proper. And that's why, please remember that this is the correct option over here. So please remember, the IVR is known as the diastole proper. Please make a note in your notes also that it is known as diastole proper. This was the question which asked in the three different entrance exam. In the PGI, first of all, the PGI used to happen in the NEET 2018 and also in the AIMS as the reasoning and assertion question, not like this. Okay, so important point to be noted. Second heart sound. Yes, you have given the answer, right? Sadik, you're right. Mansar, I hope you are corrected the answer over here. Do how many mistakes you want during the class, but do not repeat those mistakes in the exam. It's okay to make the mistake over here so as to avoid the mistake in the exam, right? You're giving the answer, I'm happy with that. Right? So that means you are putting the efforts. Second, next question, second heart sound occurs due to, I should get the answer from all of you of this question. I told you there are two options with the opening of the valves and two options with the closure of the valves. So first of all, 50-50, we are going to do 50-50 option over here. opening will never make a sound. So whenever you open a door, it will never make a sound. Whenever it is going to close, it is going to make a sound. So closure of the valve is going to make a sound. And closure of which valve? Obsessed abscess. Oh, wow, what a name. So yes, you are correct. Anybody else? There is no need to say sorry. Do as many mistakes you want over here, but do not do the mistakes in the exam. I'll be very, very happy if you achieve your goal in the exam, right? So that is why we are taking up the classes. Yes, all of you are correct. Sadiq, Manzar Ali Khan, you guys are wonderful. Second heart sound, S for second heart sound, and S for semilunar valve, or we can call it as SL valve closure. We do have two SL valve, one on the right side, one on the left side, that is aortic and pulmonary. These are the AV valves in the option C, and these are the SL valve closure is going to make a sound. Absolutely right. Medicine osmosis. I hope everything is going in your head via the osmosis, right? So SL valve is going to get closed. All of you are wonderfully given the right answer. Let's move on to the next question. The next question is telling us that which one of the following result in the C wave in the JVP? Just tell me. Option A is saying atrial contraction, bulging of tricuspid valve into right atrium, ventricular diastole when the tricuspid valve is open, and ventricular diastole when the tricuspid valve is open. Yes, guys, give me the answer again. Of this question. I'm going to wait for you guys to reply, and then as soon as we are done with this, we are going to move ahead. Yes, I'll wait for 20 seconds you to give the answer. We have read about the JVP. Tell me C wave. The only thing I ask you to remember. The only thing I ask you to remember. Yes, guys, what is the answer? The answer of this question, will it be the atrial contraction? Will it be the atrial contraction, guys? No, I told you atrial contraction is going to happen for 0.1 second, and A for atrial contraction, remember, it is going to give A wave in the JVP. A wave in the JVP, right? Yes, Aradhna Arora. Yes, you are absolutely correct, bache. Sadiq, check the answer. Manzar Ali Khan, if you're giving the answer for this JVP question, check your answer. Damaru, I hope you have given the answer for last question. Ventricular diastole when the tricuspid valve is closed. Is it going to give the C wave? Ventricular diastole, when the diastole was happening, when the tricuspid valve is closed, that means it is talking about IVR. When the IVR, I'm just going to make it again, right? So A wave, C wave, V wave over here. The protodiastole and the IVR came over here. So it is going to give us the V wave in the JVP and not the C wave. Ventricular diastole, the last option, when the tricuspid valve is open. Tricuspid valve, whenever it is going to open, the diastole is going to happen in the last phase, that is again protodiastole. And that is again going to give the V wave and not the C wave. So only thing I ask you to remember, only thing, Aradhna is correct. Manish Bhatt is also correct. Obsess abscess, would you like to change your answer, bache? It is not C as you guys are telling me. It is the option B, bulging of the tricuspid valve. I told you that IVC. IVC, that means the isovolumetric contraction, which is going to happen, that is going to bulge the valve into the, so suppose I'm going to make it over here. Suppose this is the atria, this is ventricle, and this is, let's say, aorta. What is going to happen? Or let's say this is the pulmonary valve over here. What is going to happen? That whenever this, let's say the tricuspid valve in the black color, whenever this semilunar valve is also closed, but the ventricles start to contract so as to build up the pressure, which can overcome the aortic pressure, what is going to happen? This valve is going to bulge like this into the atria. It is going to bulge like this, and as soon as it is going to bulge into the atria, the atrial pressure is going to increase, right? And that is going to give us a C wave. C wave. So please remember, IVC is going to give the C wave. Tricuspid. So you can remember cuspid. Cusp go up. Cusp up is going to give you the C wave. Cusp, in that you have U, right? Or it starts with the C. So you can remember that upward movement of the cusp, that is going to give the C wave. So remember C for cusp. Cusp bulging, right? Let's move on to the next question. Which one of the following represent the end of isovolumetric relaxation? End of isovolumetric relaxation is asked, guys. Give me the answer. I'm waiting for the answer. Ventricular volume changes, intraventricular volume changes, ventricular pressure falls below atrial pressure, beginning of T wave. So what is your answer of this question? Just give me the answer. I'm waiting for your answer, guys. Yes. Mohammad Sadiq, you're correct. Manzar Ali Khan, I hope you were giving the answer for the question before. What is your answer, guys? Give the answer quickly. I had the timer over here, but again, there is a lag, so there is no... yes, Sadiq, I got the answer from you, and you're absolutely rocking this MCQ session. Manzar Ali Khan, absolutely correct. Aradhna, बहुत अच्छे बच्चे, बहुत अच्छे. Anyone else? Right. So let's talk about the options over here. First thing, I'm going to talk about ventricular volume changes. They're asking about the end of the isovolumetric relaxation. Now, isovolumetric relaxation end doesn't mean that volume will change. There is opening of valve. Suddenly the volume will not change. Before the volume change, the pressure should change, right? So volume is not going to change immediately. Volume change won't represent the isovolumetric relaxation ka end. Okay, still the isovolumetric relaxation is going on. They themselves is telling iso, that means volume change will not occur. Then comes the intraventricular volume change. Intraventricular volume means the volume between two ventricles. Now, this is the possibility whenever you have the abnormality in the ventricles, right? So I'll make a simple diagram of the heart, which I love. That is this. You know? So suppose, usually, normally, the intraventricular septum is complete. But if we do have a problem in the patient, like we call it as ventricular septal defect, what happens is, there is opening, which is there in between two ventricles, and then only the intraventricular volume will change. Right? Otherwise, it doesn't matter what is the pressure in the left ventricle and right ventricle. It won't make much of the changes in the cardiac cycle, or it won't represent anything, right? They won't affect each other, right? Unless and until the valve is completely closed over here. Intraventricular, that means between two ventricles. So unless and until there is a pathology, we are not going to talk about this, isn't it? We are not going to talk about it. Ventricular pressure falls below the atrial pressure. Yes, in the isovolumetric relaxation, what we want to open up at the end, we want to open up the AV valve, isn't it? So we want the ventricular pressure to lower down. So in the isovolumetric relaxation, the ventricles are relaxing, so as the atrial pressure overcomes the ventricular pressure goes below atrial pressure, and the AV valve will be open. So this is the correct answer. You guys given us the correct answer. Very good, Manzar Ali Khan. Beginning of T wave. T wave beginning is going to occur when before the T wave will cause repolarization, and this is going to start the diastole, that means it is going to happen at the beginning or at the start of the, it will represent the start of isovolumetric relaxation. It is not going to come at the end. So this is also not the correct answer. The correct answer over here is option C, right? Let's move on to the next question. During the cardiac cycle, the opening of aortic valve take place at the... Yes, guys, give the answer. Abscess, you're also absolutely right. I'm very happy that you got the concept. You are giving me the right answer. That is something, the achievement of any of the faculties, that if the students understood and they are giving a proper answer, we are most happiest person on that day, right? So give me the right answer over here, and that is going to make my day. Right. So what is the answer over here, Bacho? During the cardiac cycle, the opening of aortic valve take place. Beginning of the systole, end of the isovolumetric contraction, end of the diastole, and end of the diastasis. End of the diastasis. Not able to see? But now you are able to see? Yes, I know there is lag. I don't know. I am at the studio still. There is maybe some problem because it is raining in Delhi. No issues. We are managing so many patients. We are about to manage the diseases, so we can manage this session also, right? Yes, I'm already getting the answers. Okay. Yes, guys, you're right. Manzar Ali Khan, do you want to change your answer? Abscess, you're absolutely wonderful. Mohammad Sadiq, very good. So let's start with the discussion of the options. Beginning of the systole, opening of aortic valve. Aortic is which valve, bacho? It is nothing but the semilunar valve. Semilunar valve opening. That means if suppose this is the atria, this is the ventricle, and this is the aortic valve. I want to make the opening of aortic valve, and that means I want to cause the ejection over here, right? So when this is going to occur, so beginning of the systole will cause what thing, bacho? The first phase of systole is going to be isovolumetric contraction. At that time, both the valve will be closed. So that's why this cannot be the answer over here. On the other hand, end of the isovolumetric contraction, what is going to happen? Yes, the ventricle was contracting till the point it overcomes the pressure of the aorta, if we talk in terms of left ventricle, right? And what is going to happen? As soon as the ventricular pressure is more than the aortic pressure, the aortic valve is going to open up and then the ejection will start. And that is the systole phase 2, right? That is a mid-systole. And this is the correct thing over here. End of the diastole. End of the diastole, the semilunar valve is never going to open. Otherwise, what is going to happen in the diastole? So see what they're saying in the diastole. If this is going to happen, then what will take place? The aortic blood will come back into the ventricle, and that is something abnormal. This thing is called as regurgitation. So just remember this terminology. If there is a backflow which is there because of incompetent valve, that is known as regurgitation. The blood is returning back, right? So this is the aortic regurgitation. During systole, let's say the AV valve are incompetent, the blood can go into the atria also. At this point also, we are going to call it as regurgitation, but it is going to be which regurgitation? If I'm talking about left atrium and left ventricle, there is going to be bicuspid valve, so you can call it as mitral regurgitation. MR is going to be mitral regurgitation, and that is abnormal. We do not want that. The diastasis is also the phase of diastole. In that, we do not want to open the aortic valve. Why? Because the ventricles are relaxing. Aorta already has more pressure, and we do not want the regurgitation. So do not give that answer to me. The answer over here is option B. Yes. Manzar, Mohammad Sadiq, obsessed abscess. Yes, you all are correct. Aradna, where are you, bache? I wanted the answer. I expected the answer from you also, right? Let's move on. I hope this is the last question that we are going to discuss for today. Just give the answer of this question. What is the next question saying us? This saying us that first heart sound occurs due to opening of semilunar valve, opening of AV valve, closure of semilunar valve, closure of AV valve. I want the answer from all of you guys. Yes, Mohammad Sadiq, you are rocking. It occurs in the rheumatic fever. Yes, in rheumatic fever, in the rheumatoid diseases, what can happen is rheumatoid carditis. The valves get incompetent because of the infectious agent, and they can have this problem. Yes, I'm waiting for all of you to answer, guys. Mohammad Sadiq, Aradhana, Manzar Ali Khan, Obsessed Abscesses, KK, Barnali Burman. Yes, all of you are rocking the session. That is opening of semilunar valve is not going to make the first heart sound and it is not going to make the second heart sound. Why? Because you do the 50-50 first, they're saying opening. And I already told you that the opening of the valve will never make a sound. Rather, the closure of the valve will make the sound. Closure of the door is required. So opening of either the semilunar valve or the AV valve will never make a sound. Closure of semilunar valve will make the second heart sound, that is the S2 sound. And the closure of the AV valve, that is atrioventricular valve, is A is the first alphabet, so it is going to make the first heart sound, that is going to be S1 sound. Can you just tell me, Akash Soni? Yes, guys, where were you, right? Okay, tell me. If I'm going to get the S3 and S4 sound, it is because of what reason? Just tell me S3 and S4 sound. If I'm able to hear it, it is because of what thing? Just answer it quickly, guys. Let's wrap up this session over here. First alphabet is going to be the A. That's why the closure is there. All right, so that you can get this PDF also, annotated PDF. Yes, rushing the blood. Don't rush in the answer, right? Tell me what it is called as. You are a medico, na? You should not say that rushing the blood. What's Sadiq? I expected a better answer from you, bache. What it is called as? Yes, you are right. Tell me the medical terminology. In the Viva, once I remember I asked the student, what are the heart sound? He says, duk, 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 duk. Please don't answer such answers in the Viva. Please don't do that. It made us laugh, but definitely that guy loses the marks, right? Yes. S3 sound, you can hear with one of the instrument which is there, which can get the S3 sound, lower frequency sound also. Please make a note, as we have electrocardiogram. Similarly, we have something known as PCG. Just make a note of it. The extra information, that is phonocardiogram. As electrocardiogram is going to record the electrical activity of the heart, phonocardiogram is going to record the sound. Okay, so even if it is less than 20 hertz, you can hear the sound. If you want to see phonocardiogram, go in any obs-gynae ward and there you can see the phonocardiogram, because we want to make sure that the fetal heart is working properly, and they will give you the phonocardiograms in every obs-gynae ward before the labor room, wherever the patients get admitted. There you can hear actually the fetal heart sounds, even the S3 and S4 sounds. Okay. In the normally, bache, what is the physiological cause over here? Yes. Wherever the pathologies are going to occur, whenever the volume is going to increase, you are going to get the S3 and S4 sound. Specifically, we say in the hyperdynamic circulation, okay, such as anemia condition, okay. But normally I'm asking physiological condition, both are going to be heard due to ventricular filling, right? If it is early rapid filling, you're going to get the S3 sound, and if it is a late rapid filling, you are going to get S4 sound. S3 sound physiologically where it is heard, bacho? Physiologically where it is heard? Just tell me. There's one and only condition where you're going to say that S3 is normal. That is going to be normal in the pregnant female. If the male is coming and you can able to hear the S3 sound gallop rhythm as you guys told me correctly, it is absolutely abnormal because he cannot be pregnant, right? So please remember, in the pregnant female, except in the pregnant female, S3 is going to be abnormal everywhere. And if you are able to hear S4, it is going to be abnormal everywhere. So S3 can be normal in the pregnant female. Otherwise, S3 and S4 is going to be abnormal, right? You guys are right. It is like a gallop sound. I'm going to make it. It will be heard like this, right? I hope you are able to hear it. I made the sound on the table. So it looks like as the horse is galloping, right? So that's why it is known as gallop rhythm. If you're able to hear the third or fourth sound with the S1 and S2. S1 and S2 is going to make the sound like this. But if you are able to hear like this, that is known as gallop. It as if the horse is galloping. Okay. So these are the questions I want you to solve by yourself on, before going to the exam, at least make a chart which is ready, that if this question come, what the things you are going to write, because these are the questions I took from the Delhi University as well as Haryana University, UP University question papers, last year question papers, right? Whatever I got. And one more, that is from South, I got from the Bangalore, I got the bunch of the question banks. From there, I picked up last 5 years question. So these are the questions I got. So define cardiac cycle and list the phases of cardiac cycle. That can be your question. Please, just whenever the exam is coming near, it is very difficult to, force yourself to give a proper direction. It is very important. If you're running fast, but for example, you're running the marathon, but you're going in a reverse direction, then it is going to go in vain, right? The whole of the hard work is going to go in a vain. So read and do the smart work, which is going to be very, very important, especially if you are in the first prof. So it is very important. Why? Because I'm telling you, the prof marks are important. Remember, if 10 of the student is having, let's say, 500 marks out of 700, or 800, that is the NEET exam. Now, how they're going to decide whom to give the higher rank? What they're going to see is how many of you had better performance in the profs. According to the profs, whomsoever is having better performance, he will be given the better rank. So your prof marks matters because all of you are going to get somewhere rank like this. So there are lakhs and lakhs of students who are giving the entrance examination, but you want the higher marks on the same rank, or higher rank on the same marks, then you have to do good in your profs. Okay, so the question, that is define cardiac cycle and list the phases of cardiac cycle. Draw the diagram depicting changes in the left atrium ventricular pressure, which we are going to talk in the pressure and volume changes. Left ventricular volume, again, aortic blood flow. In the volume changes, we are going to talk JVP. Today we covered this. Heart sound we covered. ECG we covered of the cardiac cycle on the same time scale. So that means they are asking you to draw the Vickers diagram. Vickers diagram. right? Whatever you can draw, just try to draw on your own, right? It is like a desert, right? So describe various electromechanical events. Again, electrical and mechanical. In the electrical event, you can draw the ECG, and mechanical event, rest of the event of the cardiac cycle that we discussed, right? Understand the pressure, or I have mistyped it. So explain the pressure volume relationship in the left ventricle. So pressures we have talked about, then when the atrial pressure will be more, when the ventricular pressure will be more, right? And the volume correlationship, you can yourself can draw it. Why? Because we have talked, whenever the ejection is going to occur, obviously the volume is going to reduce in the ventricles, so on and so forth, right? Why some of the blood left in the each of the ventricle after end ejection period? Remember that all the time you are not doing the maximum efficiency work. That is known as reserve. You should have to have the reserve all the time, because whenever you are doing some intense activity, for example, exercise, then you require more of the systolic volume. And for that, we do have some amount of blood which is going to remain in our ventricles so as to get maximum efficiency whenever it is required, right? So suppose your mom and dad, they are giving you the money, but they know that the emergency situation can come sometimes, so that they save some money also, right? So it's not that all the money you're going to waste. Some money there will be there for the emergency purposes. And same, our heart also understand the situation, that all the time we are not going to be on the quiet resting phase. We can increase our output or efficiency via doing exercise or in the stressful condition, right? For that we do have, right? So that is all from my side. I'm going to leave you with this nice message that keep calm and maintain the perfusion like your heart, right? Say thanks to your heart for being there with you all the time for you, right? I hope you like the session. If you do, please do the homework that you have to do the Vickers diagram. See you in the next session, that is tomorrow. Bye guys, and take care. Good night.